go! I should have drank the water! I gotta go! Hi, I'm Dr. Michael Berglund, and this is Common Sense Medicine. Today, I'm going to teach you how to go to foreign countries and drink the water without getting sick. So I think we can do this, all right? We have to give you a little background story, though. Man was never meant to travel 3,000 miles in an hour. 2 hours, 3 hours, even 2 months, okay? We were supposed to walk. What you need to know about Travelers Diarrhea, okay? Also called Montezuma's Revenge, the foreign Hershey squirts, the I can crap through a screen door. You get all the analogies, all right? The key behind this is your colon is seeing a type of bacteria that is foreign to it. Now sometimes that's obvious with food poisonings like Salmonella, Shigella, Campylobacter. There are certain organisms that the colon goes, no, never, no, maybe in a chicken, maybe in a cow, but not in a human colon. Now, having said that, cows have E. coli. You have E. coli. Oh yeah, well you have E. coli too, Dr. Berglund. Easy. We all have E. coli. E. coli is one of the main bacteria in our gut. I thought lactobacillus was, no, E. coli is one of the main bacteria in our gut. We do have lactobacillus, we do have bifidobacteria, we have a variety of different organisms. We even have strep in our gut, if you want to know for a fact, okay? But the key is, our E. coli, there's variations, there's subspecies of E. coli. Our E. coli doesn't make us sick. Your body knows your bacteria. Now, if we go 20 miles, 30 miles in the course of a day, the level of change from my community's E. coli that might be in the water to this new area that might be in the water, minor variation. Minor. Does it mess? My colon doesn't even know. Can't even tell. But if I go 3,000 miles, or even 1,000 miles driving, going right into Mexico, and then I start drinking the water, their E. coli is very different than my E. coli. What does that do? My colon says no. Some of you might be asking the question, you keep throwing this whole E. coli thing. What's E. coli? E. coli is short for Escherichia coli. Escherichia coli is a bacteria. In the microbiologist world, it's a gram-negative rod. It is the most common colon bacteria of all mammals throughout the earth. So just so you know, look, if you're traveling to another country, there's usually 3 things to prevent yourself from getting sick. 1, never, ever, ever drink untreated water that hasn't been boiled, didn't come from a verified treatment plant that's been properly treated, or chlorinated, because chlorine will actually, is an oxidizer that will actually destroy bacteria. Any of those things are okay, and then you've got pure water that doesn't have any bacteria. So that's one way. Second one, make sure that you've got plenty of probiotics, all right? So probiotics are those healthy bacteria. If I'm sending a bunch of E. coli, and we're talking like, if I send 1,000, that's a small amount, because these are microscopic organisms. But say I'm sending 1,000 E. coli from this drink of water into my system. If I also consume a ton of probiotics, and by a ton of probiotics, I usually mean like, it depends because there are all these different kind of variations of quantities of probiotics, but usually most of them should be at least 2 to 4 billion CPUs per capsule. So the amount of live bacteria in this little capsule is about 2 to 4 billion, okay? So if I send like 3 or 4 of these with that drink of water, now these 1,000 E. coli are competing with billions and billions of healthy bacteria. The chance that my colon's going to notice that these E. coli are there is very much reduced based on the fact there's all these healthy bacteria coming in. Number 3, and this is the least known, but from my experience in clinical practice, the one that's been the biggest help for some. A lot of people are prone to food poisoning and prone to having problems with water supply. And they don't know why. I think I do. Most likely you have a low hydrochloric acid production. Low hydrochloric. Now hydrochloric acid is produced by our gut on a normal basis. But some people have a good amount of hydrochloric acid, some people have it insufficient. If you're insufficient, guess what acid does to a bacteria? It destroys it. So if I put food into my gut, not only is it processing the protein and helping the minerals break apart so they can be absorbed, it also sterilizes my food. So if I didn't cook it plenty. Or if the water contains some bacteria, it'll help sterilize some of that, so by the time it gets into my colon, everything seems a little healthier. If you happen to be hydrochloric acid deficient, all right, you may say, well, what do I do with that? There's actually supplements that actually are betaine hydrochloride, okay? Now what you need to know is, before you go on your trip, you can't just take these on your trip and expect them to work, because you may not know the proper doses for you to take, okay? So what I tell people is, if you want to Google it, look up hydrochloric acid challenge, or if you just want to listen to this, I tell people, you take a hydrochloric acid with food, all right, and you see how your body handles it. If your body handles it okay, meaning it doesn't get warm, it doesn't burn, it doesn't seem to negatively affect, doesn't seem to feel like your body's hyperacidic, then next meal, same size, I want you to try 2, and then 3, and then 4 in subsequent meals. At some point you're going to feel like a little warming sensation in your gut. You're going to know that's more than I need. You're going to come back and you're going to go, okay, 3 a meal is where I need it. Okay? So when you go on these trips, you're going to go, I'm going to take 3 with every meal that I do, and that should help me offset it. The other one, and I know I said 3, and I'm going up to 4 now, I went on a mission trip one time, and everybody on my trip was taking anti-malarial drugs. I didn't want to take anti-malarial drugs, so I took an anti-parasitic called Paracid Forte. It has wormwood, it has artemisia, it has a few different things that are herbs that are anti-parasitic. The other benefit is also antibacterial. So what I found was a lot of people on my trip were actually getting some loose stools, some problems. I even forgot sometimes where I was and was brushing my teeth, and I went, I just used tap water in my mouth, and I wasn't supposed to. They told us not to use that, to use the bottled water, and I had no problems at all. And I attribute it to the fact that I was doing this anti-parasitic on a regular basis. So if you really are concerned, there are ways to offset and minimize and kind of prevent you from having problems in this area. Eventually, if you're going to live there as a missionary, or you're just going to move to another country, to a third world country, there are certainly ways to adapt. And once your body adapts, I'm not saying you can't get waterborne illness, but I'm saying like that you minimize the chance of having an acute a traveler's diarrhea, because basically you no longer travel there, you live there, and you share the bacteria with your community. So I still want you to boil your water, I still want you to make sure you're drinking good stuff, but if you just happen to get some foreign stuff in you, these are all ways to help you not have problems, because the worst thing is when you're on vacation to be sitting on the toilet. Those are wise words from Dr. Berglund here at Common Sense Medicine. Thank you very much.